Are we on? All right, good afternoon, everyone. It's with great sadness that I announce two new tragedies that have befallen our city government as two more city employees recently passed away due to COVID-19 virus. One, Chicago firefighter Mario Araujo, a veteran of the department for nearly 17 years and longtime member of Truck 225. The other was a man named David Villal, a member of the Department of Assets, Information, and Services, who also served the city of Chicago for many years. We are releasing their names with the approval of their families. Both of these individuals serviced our city proudly, and we honor their dedication to public service. It is that very dedication and selflessness that held us together through this terrible moment. Our deepest condolences go out to these two individuals' families and friends and colleagues who themselves are grieving and whose own lives have been torn apart by these terrible losses. These deaths are yet another reminder of the danger of this disease and the devastating impact it is having on individuals and families across our city. That is why we need everyone to continue to stay safe, remain vigilant, and save lives. I will welcome Commissioner Richard Ford, the second, to say a few words about the fallen firefighter in a moment. I'll also speak more about the latest actions we're taking to protect Chicagoans from COVID-19. However, I do want to note and say a few words about the gun violence that took place last night. 7 people were killed by gunfire in our city. 14 more were wounded, including a 5-year-old girl. Unfortunately, the epidemic of gun violence continues to plague us every day, every hour of the day. Just taking yesterday as an example, a warm day where people came outside. Individual trigger pullers slaughtered people in a totally heinous way. This level of violence is never acceptable. Never, ever. And shooting into crowds without any regard for the consequences is the most heinous form of cowardice. I've directed the police department to spare no expense or resource to bring the perpetrators to justice, and we already have some promising leads. However, coming as they do now amidst our public health crisis, these actions place additional and unnecessary burdens on our hospitals and intensive care units. Violence of any kind is never acceptable, but the fact that this is especially urgent now, as our ability to treat all Chicagoans is being stretched to the breaking point. We cannot allow this to happen, and we will not allow this to happen. People know who the shooters are. You know who you are. These cowards cannot be given any shelter. In the middle of this worldwide pandemic, our precious health resources need to be treating COVID patients and those needing acute care. Every day, we are measuring our precious healthcare resources, the number of beds that we have in hospitals, ICU capacity. To be blunt, if our ICU are filled with gunshot victims, our ability to respond to this COVID-19 crisis will necessarily be compromised. Just this week, we talked about the disproportionate burden that Black Chicago is facing with infections and deaths related to COVID-19. These same communities continue to be plagued by gun violence. I'm here to say enough, enough, enough. Our whole city focus must be on saving lives from all public health crises, whether it's the pandemic or the epidemic of gun violence. With that, I'll welcome Commissioner Ford to say a few words about firefighter Araujo. Commissioner.
Thank you, Mayor Lightfoot. Today, we mourn the loss of one of our own, but we will still respond, we will still serve, and we will still take care of this great city of ours. Our men and women swore an oath to serve when it was easy, and to serve when it's hard, and to serve when it's tough. We salute Mario for his service, and we know there will be more rough days coming, but we will stand there, we will honor him, and we will honor his memory in our hearts always. Thank you.
Thank you, Commissioner. Since even before the COVID-19 crisis arrived in Chicago, we have taken every possible step to keep our residents safe and protected. From our initial measures, like increased air travel screenings, to more recent actions, like the transformation of McCormick Place. None of this has been easy, and all of it has disrupted our lives in some way or another, and many times placed significant strains on our residents and our businesses. But everything we've done has been with the single-minded goal of saving lives, ending this crisis, and getting our city back on track as soon as possible. It's in that same spirit that I am announcing that effective tomorrow, April 9th, we are placing a 9:00 p.m. curfew on liquor sales in Chicago. A liquor curfew will remain in place through the duration of Governor Pritzker's stay-at-home order. I want to be clear on this. Like our closure of the lakefront 2 weeks ago, this is not punitive, it's protective. Nonetheless, as with our lakefront closure, we are putting this curfew in place because too many individuals and businesses have been violating the stay-at-home order, an order which was put in place to keep us safe from this pandemic and to save lives. That's why I want to give my personal thanks to Eddie Al-Khabib, owner of A&S Beverages on the South Side, along with many other liquor store owners with us today, as well as those across the city, for their unqualified support for this measure. However, while residents and businesses have been acting responsibly, I should say, well, most residents and businesses have been acting responsibly, the reality is that far too many have been congregating at stores that sell alcohol, especially in the evening hour. In addition to prohibiting liquor sales after 9 p.m., this order gives the Chicago Police Department and BACP the power to further curb noncompliance. This includes powers to fine, arrest, and revoke your liquor license and other licenses if you refuse to comply. And as I've said before, we are not messing around with this. And we will not hesitate to take even further action as needed. And this especially goes for businesses. Now look, I understand that times are tough, but if you are a business operating in violation of the stay-at-home order, you will be held accountable. We have no other choice. 8 businesses across our city have already received significant citations for violations, whether for remaining open to non-essential operations or for restaurants allowing dine-in customers when that is clearly a violation. To date, these fines in total have now reached $120,000, and we will collect them. The stay-at-home order means what it says. Stay home and save lives means what it says. I want to be clear on this issue as well. This is not a question of people going outside. We all need to purchase food and other essentials, as well as take brief walks for some fresh air. The issue we are addressing is people going well beyond that, and most importantly of all, congregating in a way that puts everyone involved at risk. Just yesterday alone, the Chicago Police Department issued hundreds of dispersal orders. This was across every one of our police districts, and that's utterly unacceptable. When you do that, you are putting yourself at risk and endangering others, including potentially costing more lives. You are also putting an additional burden on our public safety resources, which are already strained in this time. That's why we shut down our lakefront 2 weeks ago. That's why we're now shutting down liquor sales after 9 p.m. And that's why we will take even further action if people continue to act irresponsibly, including in our parks. I personally drove around yesterday, and I was up on the north side in the 50th Ward, and I'll continue to do that. I told people that I saw gathering in clusters, not abiding by the social distancing rules, to break it up. Yes, and I'll continue to do that. I mean when I say we have to protect ourselves. We have to be smart about what we're doing in the course of this pandemic. And if it means that I drive around and check whether or not people are in compliance, I am happy to do it. Now, with that in mind, I also want to take a moment to talk about Airbnbs. It has come to our attention that some renters have been holding large parties. While home shares like Airbnb were considered essential businesses under the governor's order, the stay-at-home order means you are not exempt from the social distancing rules that have already been put in place. So those holding large gatherings in rental properties, Airbnbs and the like, make no mistake, if we find you, we will shut it down, period. We're going to also look to pursue license revocations where possible, and I have no qualms about doing that. Despite all of this, I want to say to the vast majority of Chicagoans, thank you. Thank you for complying. Thank you for abiding by the stay-at-home order. And thank you for understanding that when you act responsively, you're not only benefiting yourself, you're benefiting the whole city. We've made progress, but only because the vast majority of Chicagoans are abiding by the stay-at-home order. And with the onset of warm weather, all of us want to go outside and enjoy the weather with our friends, me included. But we need to stay resolved and stand firm and continue to stay in. We have a long way to go with this crisis, and the light at the end of the tunnel remains a mere pinprick. But the more we continue to stay at home, the faster we will get through this and get back to our lives as normal. And believe me, once this is over, I'll be joining everybody in basking in a great Chicago spring and summer. So for now, though, please stay home and save lives. It's literally a matter of life and death. In a moment, I'm going to ask Superintendent Beck to come to the podium, but I want to end my remarks with a letter that I received today. This was written by a young student at KIPP Academy in the Austin neighborhood. His name is Elias Scholl. And he thanked me for the work that we are all doing to try to save people's lives. And I also want to say thank you to his mother, Mandy Tovar, who's also a teacher in Chicago Public Schools. I appreciate the warm regards that I've received from people all across the city, and I appreciate that people, even our youngest residents, understand why it's important to stay home and save lives. And with that, I'll turn the podium over to Superintendent Beck.
Thank you, Mayor, and thank you for your leadership in these very difficult times. Let me underscore what the Mayor said about last night's violence and how it affects every man, woman, and child in Chicago. Chicago suffered 19 shooting incidents and 6 homicides yesterday. One murder was particularly brutal. It occurred when a man on the Red Line platform was thrown under the train by some other men on the platform. CPD is working tirelessly to solve these crimes and has suspects in custody on 2 of the incidents, and we have strong leads with suspects identified in 2 others. But as the Mayor said, these unconscionable and cowardly acts of violence affect every one of us in Chicago, because the public safety and public health resources that these incidents, which are the most dramatic of all public health and all public safety crisis, drain from all of us, has an effect. Every one of those beds, every one of those ER beds taken up by a gunshot victim could be somebody's grandmother, somebody with pre-existing conditions, somebody that is in danger of losing their lives because of the pandemic. Every one of those cops, and there are dozens that are pulled off the street in order to work one of these crimes, cannot enforce social distancing, can't do security at our public safety venues and our health safety venues. They can't watch over your home, and they can't watch over your children. This violence has to stop. You know, there are two pandemics that face Chicago, and only one of them is virus-induced. But let me talk about the topic of the day, and that's on the closures of liquor stores and other places that sell alcohol in Chicago after 9 p.m. We've had large gatherings at a number of these locations, not all, but a number of these locations since the start of the public health orders. In total, we've dispersed over 2,000 groups since the start of those orders, and last night was our zenith, our highest level of dispersals at over 300. Many people are getting the point in Chicago, but some are not. We've done enforcement, we've done warnings, we've written tickets, and we've made arrests. Now it's time to limit the opportunities, to limit the things in Chicago that facilitate the forming of groups. And one of those is liquor stores that are open at night. I want to thank the many folks that own establishments that sell liquor that have voluntarily complied already with this request. You know, one of our deputy chiefs, Chief Cato, spearheaded an effort in his area and got a number of liquor stores to close even earlier at 6. And I applaud his efforts and I applaud the community support. But we need to do more, because this is not just relegated or impacting one neighborhood in Chicago, it impacts all of us. And again, the more we can do to enforce social distancing, the more that we can do to limit large gatherings, the safer we will all be. So let's stay at home, let's keep Chicago safe, and now it is my pleasure to introduce BACP Commissioner Rosa Escareno. Rosa.
Thank you, Superintendent. Good afternoon. My name is Rosa Escareno. I'm the Commissioner of the Department of Business Affairs and Consumer Protection. Our city is facing an unprecedented situation, and we are all being asked to take steps that have never been taken before to protect the health of our communities and our residents. And I am pleased to say that the vast majority of Chicago businesses are stepping up and are being compliant with the stay-at-home order. They are following the order, and those that are non-essential business are closing their shops as the state order demands. And those that are essential businesses are doing the right thing and following through with the orders. But I want to make it clear that these are not guidelines. These are not suggestions. These are directives that all businesses must follow. And when a business fails to do their part, then we are going to be right there taking strong enforcement. We have already conducted 690 investigations and contacted 4,000 businesses over the phone to communicate the requirements and to ensure that they understand that enforcement, if necessary, will be taken. We have a very strong partnership, and I want to thank the superintendent, because we have always held a very strong partnership with the Chicago Police Department. And we conduct joint enforcement as needed. And we also partner to ensure that we're sharing information when appropriate. Citations for violating the stay-at-home order range between $2,000 and $10,000. And as the mayor indicated, to date we have issued 21 citations to 8 businesses that have violated the order, for a total of fines of up to $120,000. These businesses include a gym that continued to operate, a bar that allowed patrons to continue to congregate inside the establishment, and a particular grocery store that failed to take steps to ensure social distancing. When we find businesses violating the order, we also take the opportunity to conduct full investigation of other violations at the location, especially when we learn that violations may be egregious. And so we're not just looking at enforcing the the governor's order. Once we show up on site, we will take enforcement on additional violations that may be present. Now, our efforts have demonstrated that the majority of our business community, who I partner with and work with all the time, are following the order. However, our residents are scared and they are concerned, and they are calling 311 and indicating their concerns. And we have received over 1,000 complaints just since March 21st. This is a tough time for our small business community. As I indicated, many of them have been asked to shutter and close, and they are doing just that. So it is really unfair when businesses are not following the proper protocols and procedures. And it is important that we support them at this time. But if they are not doing what they are required to do, then unfortunately, my team is going to be showing up. In terms of just supporting our business community, because it is a tough time, last week we held 12 webinars to promote the $100 million Small Business Resiliency Fund that the mayor put in place. And we held that in 4 languages, and over 5,000 individuals participated. So you know that there's a demand and that our business community is in need at this time. So the last thing we want is to show up and issue enforcement, but we will do so if the orders are not adhered to. We have also are working to ensure that the health department's guidance is provided to the business community, and to ensure that they're following the social distancing guidelines, and also to ensure that if an employee is suspected or confirmed to have COVID-19, providing the businesses the guidance of what they should be doing in those situations. This Thursday, our Director of Labor Standards, Andy Fox, will also be hosting a webinar for businesses and ensuring that they understand the rights of the employees during this crisis. And just as a final reminder, we will not be letting the foot off the gas on the enforcement. And so we encourage and we plead with businesses to do the right thing, because the last thing you want is more violations on your record. And our time for education, since we spent the last couple of weeks educating businesses, that time has come due. Now it's time for enforcement. So please follow the stay-at-home order. In doing so, you're protecting the health of all our community. And so I want to thank everybody who has partnered with us in doing so. And now I would like to introduce our next speaker, Edie L. Khatib, owner of A&S Beverages, to come to the podium. Thank you.
Good afternoon, ladies and gentlemen.
Good afternoon.
My name is Eddie El Khatib. I'm a business owner in the city of Chicago for over 30 years. I know I look young, but I would like to start by thanking all healthcare workers, public service professionals, and essential workers across this nation who are in the front line working to fight against the COVID-19 pandemic. I would like also to thank Mayor Lori Lightfoot for signing an executive order which grant coronavirus benefit to illegal immigrants. We are adjusting our hours for the safety and the protection of public health and the safety of our city's residents and our community, and more important than keeping our doors open for profit. We are doing what we can to work with the city to help prevent the spread of COVID-19. We will continue to comply with the order until the COVID-19 outbreak is over. Let's please applaud our heroes, and thank you. Be safe and stay home.
Thank you. All right, and at this time, I want to also recognize Issam Hani, the owner of Red Star Liquors, and many other great restaurants in Logan Square. We are friends, and he is a great, great small businessman. And I want to also acknowledge Gandeep Kaur and Goldie Singh, owners of Ferris Food and Liquor and Prestige Food and Liquor, who are also here in support of this sale of liquor curfew. Happy to take your questions at this time.
Hi, Mayor. Marcella Raymond from WGN.
Yes, how are you?
Good. I'm well. How are you?
Good.
So I've got several questions. I'm trying to organize them all so that you don't have to move back and forth and answer. So one question is from Kelly Bauer from Block Club. She's asking if will there be additional funds for rent or mortgage relief from the city so undocumented people can access it?
Well, the issue of stress on rent and mortgage payments is one that's really universal. But we are working to see if we can do a round two of the funding, and we've also reached out to various partners in the philanthropic and business community to ask for their support. And as soon as we have something to announce, we will. But we know that this is an ongoing challenge and struggle.
Another one from Sarah Schulte from ABC7. How do you plan on cracking down on funeral homes that are not practicing social distancing?
Look, we've heard from a number of funeral homes that are really struggling, in part because, not surprisingly, families want to memorialize their loved ones who have passed on. And so we're going to be continuing to work with the various state and local associations to provide guidance and support. But I know a lot of funeral directors are limiting the size of people that can actually come and gather. And unfortunately, they've had to hire extra security to enforce the social distancing rules. But we're going to continue to work with them and support those efforts. This is a very difficult circumstance for people who have loved ones that have passed on, and we want to be as sensitive as we can, but stay within the boundaries of the public health guidance that's been given.
Will they get citations if they're not following?
We're going to try to educate people into compliance, and I think many of them are really struggling to both be responsive to the needs of the grieving families, but also work within the parameters of the stay-at-home order.
Vanessa from Univision, the CDC is considering changing its guidelines for self-isolation, making it easier for those who have been exposed to someone with coronavirus to return to work if they are asymptomatic. What's your take on that?
I'm going to ask Dr. Arity to respond to that issue because I'm not up on that particular potential guidance. Go ahead, Allison.
Sure. So certainly, we talk to CDC daily, basically, really around both what has come out, what may be coming out, really wanting to understand the scientific rationale for as guidance changes. So I think some of these conversations are part of a larger conversation about what will this look like as we start to kind of look beyond stay-at-home orders, potentially thinking about how do we ensure that we can do everything that is necessary to protect people who are most vulnerable while we think about some of these larger picture questions. So I don't have a specific comment on our stance on that. We're part of the conversation. And certainly, I do trust that when guidance changes on that, it's because there's some evidence that really suggests that would be necessary. So that is not
something you're considering doing right now?
We would really look to CDC, I think, for the guidance on that, be part of that conversation, and then, take that into advisement as we look at our own local data here, our local situation, and figure out how to apply it.
So another question for you, Dr. Arwady. What can people who think they might have COVID, but they haven't gotten tested, what can they do to help? Should they wait for tests to become more widely available? Is there something they can do now? Should they just stay quarantined?
Yeah. So we've been talking about this a lot, actually, on my Facebook live social media stream with these kinds of questions. So we still don't have the widespread testing that we would love to have. Every day there's more. We're working to really get it, especially if there are parts of the city that may not have as much availability. And we're working where we're doing cluster investigations or working in settings to ensure we're bringing testing to those settings. I think, from the beginning, we've really been saying where there are people who have a mild illness who otherwise would not need to seek medical care, there's not a need to get a test for your own personal, nothing changes in terms of what will happen to you personally. There's still not a specific treatment available. There's not a vaccine available. And if you are well enough to not need to be, in a hospital type setting, you'll be encouraged to return home. This is where some of the conversation about the isolation and quarantine hotels can come in, because if there's a situation where someone may not be able to return home because there's a vulnerable person, there's some opportunity there. But I think the test itself, we don't need your test to know what is happening at a population level here in Chicago or around the world. We're doing some accounting, knowing that there are people who are not getting testing, and we're following people who are sick enough to need to be in the hospital or certainly in the ICU, tracking all of those numbers and using a lot of those for predictions too. There will be other tests that come available. The test that is available now, the most important one, is this nose test that we've been talking about, a PCR that's looking for the active presence of virus in your nose. What is in development, we're starting to just see it in early use, is an antibody test, which is a blood test, like a finger prick, that allows you to know, have you been exposed to coronavirus? Did you recover from COVID? You actually are able to see in the blood the immune response that your body has had to COVID. And so we're in conversations not just about the test right now, the nose, but thinking about some of this antibody blood testing, which at a population level will be used. So we're going to be putting out some more information probably the end of this week or early next week about some ways that individual people will be able to do some registering of symptoms and some ways for people to get more direct information. Like I can put in, here is my symptom today, get some individual information about what to do, and we'll be using that same platform later to think about antibody testing. And even frankly, we're already doing a lot of planning and thinking about a vaccination campaign in the future. So a lot more to come on that. But bottom line is, if you're not able to get a test, we understand that there still are not those widespread tests available. Stay home, be in touch with your provider, though, by phone, especially if you're in that underlying, people with underlying conditions or people who are older. There are tests available when people are having more significant illness, or if they're in this high-risk category. We do want those folks to get tested, and that would be done in conjunction and in decision with a healthcare provider.
Thank you.
And let me just also make a plug for the website. Kind of the basic, what do I do when I feel sick guidance is actually on the website, chicago.gov/coronavirus. It's on the first page of that, along with a host of other information about resources that are available for those in need.
Madam Mayor, did you touch on the numbers today? Did you say that, unless I missed it? What is our status in terms of who's been tested positive and how many deaths we've had?
We typically reveal those numbers following or during the governor's 2:30 press conference, so we don't have an update of those numbers yet, but they'll be coming later today.
I have a couple questions for Superintendent Beck.
Yeah, sure, of course.
So Superintendent, the man who died yesterday being pushed off the platform, one of the websites is saying that the suspects are known because they have caused more issues on the red line as well. Do you have any answer to that? Can you tell me where the investigation stands?
Well, we have some very strong leads on that murder. I expect that we will solve it. I don't want to get any further into it than that right now because of the ongoing investigation. So thanks for the question, but that's as far as I can go on that.
It was captured on video. Can you?
There is video. There is video, as there is all over the CTA system, and everybody should know that if you commit a crime on CTA, we will catch you, as has been evidenced over the last month or so. Even when we have difficult public safety issues on the CTA, we solve them, and we will solve this one.
Would you say you're close?
I just did.
Okay, thank you. Commissioner Ford, I have a question from a CFD firefighter who says that the LA County Fire Department is seeking to ease strained ER resources by allowing its paramedics to connect mildly ill people with nurses via teleconference. Is that a possibility here? Are you working towards that?
Well, we've worked with Dr. Arwadi. We've had that discussion. It is not solidly laid yet, but that's one of the things we are discussing in the near future.
So that could be something that would come to fruition
possible.
soon? Just it's possible?
It's possible.
Okay. I'm done.
Let me also add, for City of Chicago employees, and I think this is true for a lot of employers, telemedicine is a service that's provided under the policies, and we certainly are encouraging people to make use of those resources.
Several questions over here, Mayor. First couple, I should say, from Fran Spielman at the Sun-Times. The head of Disney World is talking about mandatory temperature checks when the park is able to reopen. Do you envision the same thing happening at City Hall and other government buildings or public places when we are on the other side?
Well, we're looking at, we're always looking at other opportunities to step up and keep our workforce as safe as possible. So we have a number of things under discussion, and when those become solidified, we'll certainly let the public know.
At next week's City Council meeting, do you envision substantive business being conducted or just enacting rules that allow for virtual meetings?
We're in discussions about that, and once we finalize the plan, we'll let the public know.
One more for you and then one for Superintendent Beck. And when will the confirmation hearing for David Brown be held and the vote on his nomination be held?
When we decide on that, we'll let the public know.
Superintendent Beck, a question for you from Fran Spielman. Are you aware of police officers being asked to do roadside safety checks? If so, for what reasons and for how long?
We are doing traffic safety checks in every district, all 22 of them. They started last night. They will continue through tonight and until we deem them unnecessary. They're for two purposes. Primarily, they're traffic enforcement to ensure seatbelt usage and to check for driving under the influence. But they are also being used as informational opportunities to make sure that everybody understands that essential travel is the only thing that's permitted in a vehicle. Essential travel only. If there's no wandering around, no driving around, no going places for no reason. Essential travel only, and we will provide that information to people that we stop.
Mayor, a question for you from the BGA. Mayor, you recently raised alarms about disproportionately large numbers of COVID-19 cases among African Americans. The timely release of this government information is essential to public understanding of COVID-19. Yet at the same time, you are supporting an effort by the Illinois Municipal League for a blanket denial of public record requests until Governor Pritzker's stay-at-home order is lifted. Attorney General Raoul has said he does not believe he has the power to issue such a blanket denial. If public information is essential, pursuing good public policies such as addressing inequities about the impact of COVID-19, why should local governments be able to deny FOIA requests across the board, and how do you square this with your promise to fight for transparency in government?
Well, unfortunately, the BGA has a lot of assumptions that are baked into that question that are just plain wrong. So let me take them one at a time. Number one, we have absolutely raised a concern about our ability to be able to respond to FOIA requests in a timely fashion. That doesn't mean we're saying blanket denials. Take, for example, the information that we talked about on Monday regarding the disproportionate impact of COVID on African Americans regarding cases and deaths. That information is on our website, and it will be updated daily as it has been. So we, in respect to COVID in particular, we are placing a significant amount of information out in public view to be transparent, help educate folks, and also give them information about resources. So the notion that we are somehow being less transparent in this time is just belied by the facts. But the other thing I have to say is this. As I emphasized in my opening remarks, what we have to focus on as a city is saving people's lives, period. That's the mission, saving lives. And when I think about, for example, the Public Health Department, where we've got epidemiologists, and those are doctors who are trained and looking at patterns in viruses and other things that are relevant to this time, who are crunching data, providing analysis, and helping generate the information that is the foundation for our modeling and predictions about what the slope of this virus is. I want to ask the average Chicagoan, would you like them to do their job, or would you like them to be pulled off to do FOIA requests? I think for those people who are scared to death about this virus, who are worried every single day that it's going to come to their doorstep, and I'm mindful of the fact that we're in the Pesach season, the angel of death that we all talk about is the Passover story. That angel of death is right here in our midst every single day. So what I think most people want is for us to be focused on saving people's lives so that we don't have to bury another grandmother, another mother, father, a policeman, a fireman, a city worker. That is what we were focused on. And in this time where we are all straining, where we are pared down to just the essential services, it is difficult. It is difficult for many city agencies to be able to respond to the FOIA requests that have heightened. Much of the information is already available on public websites. So yes, this is an issue that we have raised with the Attorney General. We will continue to raise because it is something not just in Chicago, but across the state, where in many small towns and municipalities, they have no one who can even respond to FOIA requests. We have resources. We will use those resources to respond as best we can. But in the pandemic, we need some relief so that we can focus on the core mission, which is saving lives.
Great. Question from Politico. How is Chicago trying to avoid becoming the next New York, and is the city getting what it needs from the federal government?
Well, if you look at statements that we've made over the last month or so, I think we've been very clear about what we're trying to do to save people's lives. So I would just refer back. I don't even know how to answer that question, given that we have been talking literally every single day since the end of January, beginning of February, about the things that we're doing to keep people safe.
We only have time for 2 more questions. Question from Chicago Public Square. What can people who think that they've had COVID-19 but who have recovered do if they have not yet been tested? Should they wait for tests to become more widely available, or is there something they can do now?
I think Dr. already really addressed that question previously, but I'll invite her back to the podium.
Yeah, I'll just add that there is not a role for testing of this PCR nasal-based testing for people who think they may have had it in the past. It doesn't work like that. It has to detect actual virus sort of in your body at the time. I will sort of preview a little bit that when we have this more public-facing app/site available, individuals in Chicago will be able to put in some of their own information and be able to tell us about symptoms that they are having in real time or have had. And we will be using some of that on a population level, both to think about some of that antibody testing as it becomes more approved and more available, and thinking about pre-registration for vaccine down the line. So I would say stay tuned on that. If you think you've had COVID and you're feeling well and you're back and out and about, that's a good thing. And not a need for testing at this time.
Question from WBZ for Commissioner Escareno. How many applications have come in for the Small Business Resiliency Loan Fund? Will there be enough to give every applicant some assistance? Timeline for getting the money out?
Sure. So as you know, the need in the business community is great, and we're still working through that through the application process, but we have received thousands of requests, and in terms of timeline, we're still in the process of onboarding a couple of additional microlenders, but we're already reviewing applications. And in terms of when the funding will be distributed, will really be based on the capacity that we have, and the, in terms of our goal is to try to get those out as soon as possible.
Thank you. Question for Commissioner Ford from Parish Schutz. How is CFD doing in terms of staffing levels, morale, and how equipped is the city's fleet of ambulances and emergency response vehicles to deal with increased COVID-19 calls?
Well, of course, our manpower is fine right now. We're adjusting to what needs to be done in order to keep the city protected, of course. We, in fact, have 4 ambulances that completely do nothing but COVID runs, and that, in fact, has covered 80% of the runs that we've had. Right now, we're doing really well. We're looking and working with the union and, of course, the mayor in order to make sure we're serving the city.
Thank you, everyone.
Thank you.